Good afternoon, everyone, and welcome to the Black in Quebec Community Forum. Just to let you know, French interpretation is available for everyone who wants to listen to this presentation in French. You can click the interpretation button at the bottom of your screen. L'interprétation en français est disponible pour tous ceux qui souhaitent écouter cette présentation en français. Vous pouvez cliquer sur le bouton d'interprétation en bas de votre écran. My name is Ayana Manyuma, and I will be today's moderator. We want to begin the day by acknowledging that we are on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the land and waters on which we gather today. Tiohtià:ke, Montreal, is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other people. Our Canadian history is suffused with shameful stories of mistreatment to its people. It is critical not to forget nor camouflage the truth of the past in order to move forward and begin reconciliation. It is important to highlight the respect we must have to uphold the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other people within the Montreal community. Thank you to all for joining us today. I would like to begin by thanking our funders, Canadian Heritage, and the Secretariat for Relations with English-speaking Quebecers for your support in making the Black in Quebec project possible. We also want to thank all the people who have volunteered to help us with carrying out the project. That includes members of the research committee, volunteers and interns, and individuals across a number of fields whom we have consulted with. Today's presentation will offer an overview of the Black in Quebec project, and you will have a chance to hear about the stages of the research from conception to findings and recommendations. As I mentioned, I will be moderating today's webinar, where the main project researchers, John Davids and Cheyenne Fang, will discuss the journey they have been on for the past 16 months. But a special thank you must also be given to the technical team behind today's presentation and behind the scenes, Hugh Maynard and Shania Bramble and Sarah. Furthermore, the project team thanks the BCRC family as a whole, including Rayanne Francis, Clarence Bain, Yvonne Sam, and every member of the community who are the very reason this project exists. In the spirit of collaboration and cooperation, and to give you a break from 2 hours of Cheyenne and John, we also wanted to thank today's 3 distinguished guest speakers who not only agreed to take part in today's event, but who have truly been a great help in the project team in helping us grow our understanding and continue on our research journey. Roxanne Vaillancourt is a supervisor at the Statistics Canada Data Center here in Montreal. Sita Ramdas is a board member of the McGill University Health Center and co-chair of the MUHC Committee for Action on Inclusion, Diversity, and Equity. And Dr. Richard Kessner is a professor in psychology at McGill University and the founder and director of McGill's Human Motivation Lab. Thank you all for your participation and for what you have taught and continue to teach us. We truly appreciate the nature of our collaborations and discourses and hope to encourage these sorts of interaction because we can testify that they have helped us on our journey. So now I'll just give you a brief outline of the event. We will begin the presentation with our keynote speakers. Following this, we will hear from John and Cheyenne, who will discuss the data collected. Next, we will hear from our first guest speaker, Roxanne Vaillancourt, who will offer a brief presentation about Statistics Canada and how someone unfamiliar with the organization may begin to utilize the service and products offered. We will follow with our first question and answer session before pausing for a 10-minute break. Afterwards, the project team will be discussing the project findings. The second guest speaker is Sita Ramdas, who will be presenting on the health sector. Our third guest speaker is Dr. Richard Kessner, who will also be contributing by offering a presentation on psychosocial dimensions of the project. Finally, the project team will wrap up with their closing statements before the final question and answer session. Please note that all viewers of this webinar are muted and can only be unmuted by the host. Viewers will have 2 opportunities to ask questions, and they will be able to do so by typing them in the question and answer box, which they should see at the bottom of their screen. So now, j'aimerais maintenant introduire William Flock, secrétaire adjointe de Secretariat aux relations avec les Québécois d'expression anglaise depuis 2017.
Merci beaucoup. Thank you. I'm going to be very brief because we have a lot of interesting content coming up. I want to just say a couple of things about what a project like this means for us at the Secretariat and within the Government of Quebec. I think that there's really no question that having an understanding of the context in which English-speaking communities live and exist is very important. So having research that describes the communities, both qualitative and quantitative, is really important. Our thinking, and I'm sure it's the thinking of those who promote this project, is that that can then lead to some policy reflections and ways that we can ensure that that programs and services are better adapted to the needs of populations. So from that point of view, we're very proud to be affiliated with this project and be a supporter of it. There have been many interactions between the research team and BCRC on this project. So we're very pleased to see the progress, and having today as an opportunity to really share some of the results with a broader audience is a great opportunity for sure. I would note too that one of the things that we've been really interested to see is that you know, there's a group of young researchers attached to this project, and we think that's very important. The notion of la relève and the idea that young people are having a chance to come to the table and you know, be part of building an understanding and working towards strategy and solutions. That's great, obviously too. You know, we often, you know, the phrase minority within a minority can arise in this context, but of course there's other layers and other levels here. We have Black English speakers are a minority within the English speaking community. English speakers are a minority within Quebec, and Quebec Francophones are a minority within Canada and North America. So of course, all of those dynamics of groups within groups, it's very complicated, and therefore it's very important that groups like the BCRC and its affiliated organizations have the chance to develop their own narrative based on their own data gathering and their own analysis of existing data. So I think we're very keen to support projects like this. Maybe just a last observation. The looming arrival next year, and I think we're going to hear more about it from Roxanne Vaillancourt of StatsCan, data from the 2021 census will of course allow all of us to even have a more up-to-date understanding of some of the broader trends that affect Black English-speaking Quebecers. So sometime, you know, over 21, 22 and into 23, we'll all have the opportunity to have that kind of framing data that will help position all of this. So we're certainly encouraged that BCRC has reached out to Statistics Canada. There are other research bodies too that within the Government of Quebec that we can try to build bridges with as well. So just to say then that like all of the other participants here, I'm very eager to hear the results, and I know that there's some interesting presentations coming up. So have a great conference, everybody. Thank you.
Perfect. Thank you, William. I would now like to introduce Dr. Clarence Bain, President of the Black Community Resource Center, to make the keynote address for today's event. Dr. Bain, I would invite you to unmute yourself.
Can you hear me now?
Yes, yep. Now we can hear you.
Sorry about that. Welcome to Blacks in Quebec, a complex and adaptive system discussion and analysis of data produced by the continuous and dynamic changes and dependencies between intelligent agents and with other agents and elements in the environments and situations which are characterized by the varying degrees to which they accommodate or are hostile to our lives, growth, longevity, vitality, and purpose. Today, we take a closer look at Quebec's Black community response to change in the Canadian biospheres or ecosystems that directly or indirectly affect the existence and fitness of Blacks. That is to say, their sense of being and success in the search for state sets or combinations of utility producing factors that provide the Black communities with the greatest utility and purpose. That is to say, the greatest sense of their maximization of well-being and improving their location or position on the social index. Here at BCRC, we have created a research team supported by a community network of experts. The central objective of the research team is to facilitate the creation of learning systems and to apply digitized research mechanisms and algorithms aimed at helping to reduce the gaps in community knowledge and ingenuity. It has been established in the literature, and I suggest that you get it. When you get a chance, you read Thomas Homer Dixon, The Ingenuity Gap. It's very important. It has been suggested that these gaps in ingenuity within minority groups, such as the Black communities of Quebec, act as barriers to the development of members of the subgroup. The research team, our research team and network of experts are here today to provide a comprehensive overview of the research they have done and to receive questions from you, and they will attempt to answer these questions. I would say that human needs and wants are at the center of this, and human needs and wants are satisfied in a world context and local context by the activities of intelligent, thought-capable human agents. These activities are classified as production, distribution, and consumption of goods and services. The activities, including allocation and distribution of all goods and services, are proxy variables indicating the location of a group on the social index. That is to say, the level of objective and subjective well-being attained by members of the subgroup. To analyze the status of Blacks in Quebec, the BCRC team draws on the findings and the results of the management of the data gathered and on simulations derived from multi-agent complex adaptive systems activities. These models define Quebec as a consistent of interacting agents, diverse human subpopulations, creating organization structures, cooperating, collaborating, or competing. The production activities is really a combination of utility producing factors and resources to provide these goods and services that satisfy essential life needs and wants, of course. The research team demonstrates the effect of culture, ethnicity, competitive rivalry, and systemic discrimination, social and environmental change and uncertainty on the resilience and sustenance of the vitality of subgroups, in this case, the Black in Quebec, other visible minorities, English and French-speaking non-visible minority groups, etc. John, can you go to the slide, please? The slide that you see before you here approximates the Quebec environment system situation as two interconnected subspaces, a belief space and a people's or population space. all human activity in these spaces are assumed to be directed at the creation and expansion of life through reproduction, of course, and its security, its longevity, and its attainment of the greatest satisfaction possible or feasible. The belief space at the top of the diagram represents the collection of knowledge classified as situational and normative. That is experience-based information, statistical databases, studies, organically achieved knowledge or skills attained by training. The other aspect of knowledge is the capacity to be innovative and the acquisition of ingenuity capacity. It is the capacity, this is the capacity of the human subgroups to respond to unpredicted or unpredictable occurrences in the ecospheres creatively. For example, COVID-19 is such a situational change that requires the use of stored knowledge and ingenuity to produce solutions. The space at the bottom of the diagram represents the people or population space. It is where the goods and services are produced and delivered, and where any imbalances of any kind are determined and adjusted for. The delivery of goods and services are partly guided by market forces and prices, and the protocols and initiatives to reap the net benefits by the owners of the utility producing factors used in production. Part of these net benefits are also shared. They're shared to reduce gaps in earnings and ingenuity capacity in communities of marginalized member groups. This is what you may call a value-based driven process. And it is based on the concept that social and ethical principles that recognize the individual's right to life and happiness. It is postulated that gaps in ingenuity capacity, for instance, can and do frequently lead, for instance, to insurrections, protests.
I'm sorry to interrupt, Dr. Bain. It's just to let you know that you have 2 minutes left.
Excuse me?
You have 2 minutes left.
Thank you very much, yeah. I don't think I'll need more than that. In order to, just me. Yes, as I was saying, that these gaps in ingenuity can lead to serious problems of instability in communities, and we have many instances of this as we look around the world at, say, Puerto Rico, Venezuela, the Middle East, the Black Lives Matter protests worldwide, the unrest in Hong Kong and South Africa. To avoid these instabilities in the population space situation and normative knowledge that we have gathered is used to create systems of sharing so that the collective wealth of the system is distributed in a way that is generally considered fair and equitable. Sean, could you just switch your slide, please? The Canada and Quebec environmental system are hostile to Black settlement. And we look back, we can see that over the 100 years, 1833 to 1963, successive administrations have used the immigration laws and between administrators to keep Blacks out of Quebec, where we have, it's in general, the full integration of Black into Quebec society and their representation in government and public services has gone unattended, notwithstanding, it has been addressed in certain ways, but generally unattended in the most fundamental ways, notwithstanding the task force such as the Yule and James task force. The findings of our research team seem to support the claims that we often get from members of the community that the Black community in general seems to have been ignored and underrepresented in Quebec, that we have been excluded from job earnings, incomes in excess of $25,000 a year. We've been marginalized, predominantly live in neighborhoods with significantly poor housing conditions, that we are more exposed to vulnerable to health hazards and mental health issues resulting from social exclusion, anti-Black racism, and systemic discrimination, and that we've been reduced to the lower ranks of the political, economic, and social decision-making processes of the society. That's what we hear. In other words, the team seems to be discovering in its larger and more in-depth analyses. The policy implications of this seem to be that cultural groups, especially in the Black community, must continue to develop organizations and programs that increase their access to greater education resources and skills, training essential to their survival, reproduction and the sustaining of a satisfying quality of life for their members of their community. Now, given the implications of Bill 96,
Dr. Bain,
yes.
I'm so sorry. We will have to conclude your keynote speech so that we can move on to the next speaker now.
Yeah, well, you could say that I have come to the end. Therefore, there is a need, I conclude, for the Black community to close gaps in communication and information flows across the entire landscape. This will speed up the rate with which groups that have ingenuity gaps among all organizations and communities reduce those inefficiencies that result from such gaps and attain alternative and hopefully higher levels of fitness on this continent. I thank you very much for having invited me, and I'm sorry that I have taken additional time that is clearly visible, important for others. Thank you.
Thank you, Dr. Bain. That was very insightful. We will now be hearing from the project researchers, John and Cheyenne.
Thank you, Ayana. Thank you, Dr. Bain. There's nothing to apologize for. I thought that was a lovely opening remarks. Thank you, Mr. Flock, as well, for your opening remarks. And thank you to essentially, I want to echo Ayana's thanks to everyone who helped make this project possible. So we're here to present the Black in Quebec project and give an overview. This is a project which myself and Xiaoyan commenced in March of 2020, and we've been doing so for the past 16 or 17 months. And when it comes to what the purpose and aims of this project are, well, the purpose behind the project, which was also kind of echoed by Dr. Bain, but is essentially to comprehensively research the English-speaking Black community with a particular emphasis on the vitality and well-being of the community. Our aim is to be able to inform ourselves, our organization, the Black Community Resource Center, as well as other community organizations who also have a focus on the English-speaking Black community in Montreal or Quebec. And lastly, to also help inform other community stakeholders about the state of well-being of the English-speaking Black community using an evidence-based approach that also accounts for the complex nature of community well-being as best as we could. So some of these aims include also reaching out to individuals in the English-speaking Black community who might be isolated or uninformed about the services and resources which are available to them. supporting efforts aimed at enhancing the services that provided to the English-speaking Black community from Black community organizations such as the BCRC, sensitizing the larger community to the detrimental effects of social exclusion, racism, and by sharing statistics that show the collective and personal barriers facing members of the English-speaking Black community, reducing the gaps in knowledge and information between the community and mainstream society or wider society, and also to promote social inclusion and civic engagement of individuals within the English-speaking Black community. But our aim also goes a bit further than that. It is also hoped that by collecting and presenting this kind of information, it can hopefully lead to a response from policymakers and people who hold power in this environment, which can address or start to address some of the challenges, problems, and barriers facing English-speaking Black Quebecers' well-being and community vitality. To say it simply, it's just that, you know, the research in itself doesn't just solve problems as is, but actually needs to be continued by formulating and implementing solutions. And for that to happen, there needs to be the will to do so. There needs to be a care invested and clear interest in addressing these problems. And so without that, it's difficult for research to really lead to any substantial or significant change or impact. I'll then say what this leads us to is our research question, which, to put it in one statement, is what is the state of objective and subjective well-being pertaining to Quebec's English-speaking Black community? To break down this question really quickly, Mr. Flock already alluded to minorities within minorities and the complexities of that. And so the English-speaking Black community is in fact a double minority in the context of Quebec, in that the English-speaking Black community is a racialized and linguistic minority in the context of Quebec. And Quebec is a more than unique province as well in the country of Canada overall. So we want to understand how this group is doing relative to other linguistic and visible minority subgroups in Quebec. And when it comes to well-being, what we actually mean by that, I know it's a fairly vague term, but how we proceeded as a project to identify that was by looking at or creating thematic areas to ask this question. And our 5 thematic areas of this project are the economic, educational, health, psychosocial, and sociocultural. Of course, this also has its limitations, and there are people who might suggest that there are also other dimensions that in the future we could look into. For instance, environmental could have been just an example of another thematic area. When it comes to the project phases and the methodology, this project was carried out across 5 overlapping phases, or at times they were overlapping. It began with designing the research, which included assessing the current information available, reviewing the past studies, conducting a gap analysis. Dr. Bain already alluded to what do you mean by gaps, and also thinking about, or at least articulating clearly and developing our methodology. Then is also the community outreach, which included engaging with wider communities through forums, discussions, meetings, focus groups, and even through social media. Then is the data collection. We collected data in our project through interviewing people, through surveys, through questionnaires, and through meetings. Analysis, which was analyzing and comprehending the data and information we collected, and then ultimately reporting this information or presenting our results. So we presented our findings and continue to do so in the shape of reports or infographics, with the hope of spreading awareness and sensitizing the wider public to some of the issues facing the English-speaking Black community. In terms of methodology, the project adopts a holistic approach in that the concept of well-being includes both quantitative and qualitative information, and understands these areas, which I mentioned, the 5 thematic areas, as being interrelated and yet distinct aspects of being. Furthermore, given the complexities of studying people and the difficulty of doing so, and the various factors and dimensions involved in doing so, this project also adopted a complex adaptive systems approach, as referred to by Dr. Bain, and in short, we see that the English-speaking Black community as a group amongst a number of other groups in the Canadian and Quebec social landscape and social systems in which we're operating. And we exist alongside these other systems, which also have the potential to affect and influence the social equilibrium well beyond just their bounds alone. So in other words, we attempt to acknowledge as best as we can the limitations of our knowledge and the potential for things which may not be expected directly related as potentially causing a huge impact on the social relations and state of well-being of the English-speaking Black community. I know Dr. Bain in his opening remarks referred to the shock of the COVID-19 impact, of the COVID-19 pandemic, and how that's impacted multiple communities in a range of different ways. And it's also here that I'll introduce this, but we'll speak about it later in the presentation. But we also thought it absolutely necessary to define the terms we're working with. That is to say, we had to articulate what we mean by the term English-speaking Black community member. Who is part of this community and how do we define it? Given the fact that there may not be shared definitions. So we had to adopt our definition of what we mean when we refer to someone as being in the Black community, and our understanding in terms of concepts such as race, racism, racialization, and so on. This was an absolutely fundamental aspect of our project because not doing so can lead to you dealing with materials in which these terms are conceptualized and defined differently. In other words, you may soon come to realize that there's actually still a debate that's alive when it comes to definitions, and language is in and of itself a battleground for differing concepts. We could be using the same term, for instance, race, and yet mean something completely different. By not defining it, it is uncertain whether we have a mutual understanding of the concept being discussed, okay, or not. And by not defining it, a vagueness is allowed to ensue. And this is especially of concern if the goal is to generate positive change and create solutions to address problems facing specific groups, particularly racialized minorities, in order to create solutions to address these problems facing specific groups of people. So that's something we right away that our project had to deal with. In terms of the three kind of main aspects of our project, and we're going to talk about the findings later, as Ayana mentioned, but we just wanted to start by saying that we compartmentalize our project in three distinct parts: analyzing available data, collecting our own data, and the dissemination process. Firstly, the available data we observed and analyzed in order to help us answer the research questions. These included data sets, literature, reports, and more from a variety of sources, including other community organizations. You can change the slide, please. So yeah, all I'm saying is that our information was sourced from community organizations, academic journals, some media, different kinds of institutions, including Statistics Canada, who you'll hear from Roxanne shortly. Some academic institutions, and even international institutions such as like the United Nations Working Group Report for Canada. So while already this seems like a plethora of data, and it was quite extensive, and it is quite a lot, it still had challenges because we were still presented with challenges in terms of having our research question addressed. That is to say, a lot of the stuff spoke to different populations that aren't as unique or specific as the English-speaking Black community in Quebec. Challenges also included the age of the data. For instance, with the census, the most recent data we had access to was 2016. The level of detail of accessible data, as I was just saying. In some cases, we were looking at data that talked about Black Canadians overall or visible minority Quebecers overall. And the amount of data collected, because not everywhere collects race-based or visible minority data. Just in case you didn't know, Quebec, the province of Quebec does not do so within its institutions as well. And so these are all things that provided some challenges with the data we had, with the data that's already available. And also lastly, as previously alluded to, definitions, trying to understand how these sources of data kind of conceptualized these terms like race or Black or English-speaking Black community. these are also something we have to keep in mind and consistently grapple with and try to just make sure we understand. In dealing with these challenges, we've also always sought ways to understand more about the options that are available to us in terms of acquiring existing data. This has included considering the purchase of data, which is not publicly available, and or accessing data sets, which may require a lengthy and costly application process through consultations and collaborations. So in our position with limited resources, any detailed data which is essentially free or accessible has been very valuable, and the few purchases we have made were made quite strategically and carefully thought out. Ultimately, upon compiling all this data and information, we created a few resources, which I'll go into shortly after, and identified some of the information gaps pertaining to the well-being of the English-speaking Black community. Now, for the next slide, in order to minimize the impact of the challenges, the project team also said, well, we have to collect our own data. And we did so either by ourselves or through collaboration with other organizations or partners. The data collection on behalf of the project team included focus groups, which were actually one-on-one interviews we conducted with members of the English-speaking Black community. And this was given the uncertainty in April and last May about really ever being able to meet in person again. We weren't sure. And the new transition towards video conferencing as a normal means of communication, as you're experiencing right now with this Zoom webinar. The interviews we had lasted around an hour and a half, and we specifically reached out to a diverse but small group of individuals in the English-speaking Black community who were involved in a variety of fields and who were willing and able to offer their perspective on a number of issues affecting the wider community. Backgrounds ranged from the arts, educational sector, community organizations, even some religious organizations. The aim was to collect detailed qualitative information about the community and see where the commonalities were, but also how the unique knowledge and how the unique knowledge and backgrounds of the participants might have led to unique perspectives. The interviews were initially semi-structured in that they all covered the same thematic areas, but questions weren't necessarily articulated in exactly the same way, as the point was to hear as much as possible from the participant without confining them to respond in a structured sort of way. However, questions taken from the sense of community index were also incorporated, and the goal being to attempt to understand how the respondents felt in relation to the wider English-speaking Black community specifically. We also had a second phase of focus groups where we collaborated with Charisse Etienne. She's the project coordinator for the BCRC's intergenerational program, to hold intergenerational focus groups where we spoke to small groups of members of Montreal's Black senior community and held semi-structured group interviews. Ultimately, as part of the focus groups, we spoke to 34 individuals altogether. A second part of our data collection was a collaborative survey we conducted with Dr. Richard Kestner and Dr. Ann Holding from McGill's Human Motivation Lab. I'm not going to go into too much detail because he will present on the study afterwards, so I don't want to ruin it. But just to say that with the psychosocial well-being being one of the thematic areas of interest, and in addition to the politically and socially tumultuous year that was 2020, we had a great interest in understanding how the Black community was coping in that environment, in that time, in that context. The context was unmatched, and thus the value of older data for us wasn't quite the same, as there was a shock in the environment last year and one that we're still going through today. So to summarize, we collected information regarding the psychosocial well-being of Black youth together with Dr. Kestner and Dr. Holding, and you'll hear a bit more about that shortly. But the last part of our data collection also consisted of our 2021 Community Vitality Survey, which lasted from late April to the end of June. It may be a reason why a few of you are here today to hear about that. And we had designed this survey to try and cover information gaps we had previously identified, but there were definitely many other factors that went into creating this survey. We had to pay attention to space. We had to try to maximize respondents' attention and not make it boring so that they get bored and don't do the survey. So we really tried to curate it to get as much value out of the data as possible without overburdening the respondent. The purpose of the survey ultimately was to gain an up-to-date understanding about the state of Quebec's Black community as a whole across the aforementioned thematic areas related to well-being. And we had consulted with our research committee as well as other experts in fields such as health to design this survey. We understand and we understood and still understand that there would be limits to the amount of complex information which could be collected. But given the overall limitations of available information pertaining to Quebec's Black community, we still felt that a limited analysis could still be a valuable contribution to the overall literature. And this feeling was reinforced in that we asked certain questions as well, which weren't commonly asked in surveys that might be given out by, let's say, Statistics Canada, for instance. We asked some unique questions that we didn't know where it would go. We felt that it would be important to understand the status of the Black community overall, and from there we shift towards dissemination of that data. And just to kind of make it fairly quick, because I'm running out of time here, our dissemination kind of consists of three main aspects. The first is the infographics. So these are kind of one-pagers or maybe two-page at max documents that focus on a specific theme. Usually they come with some tables or some graphs. They're really meant for the wider public to be able to read and grasp some of these ideas as easily as possible. And we've created several infographics since starting, many of which are available on our website. But we've also posted them on Samaji, the BCRC monthly newsletter, as well as our own Black in Quebec newsletter. I'll just say right now, if you'd like to subscribe to the newsletter, please just mention it in the chat with your email, and we'll gladly add you to the list. Second part was reporting. So each of these things that I was saying before about analyzing existing data, collecting our own data through focus groups in the survey, all of these finish with a report. We have an analysis of outcomes and information gaps. That's a document. It's available to order. We have a few other documents that will be coming through the pipeline over the next few weeks in terms of being put up on our website and published. But if there's any specific thing if there's any specific aspect of our project you have interest in, if it's not on the website, please just don't hesitate to reach out to us and ask, and we'll either have a date for you or we might just send it to you directly if that's the best way to do it. And then lastly, we also had our website, as I mentioned, where a lot of this information is available, but at the same time, it's still being added to, it's still being constructed. I would say the big highlight of our website and our web page is the creation of what we call the data center. So in this, essentially, we want to turn our webpage into a knowledge hub where our publications are available, where the data sets we've been working with are available for other researchers to take a look at and run their own statistical analyses and their own statistical tests. And even the articles that I read that were published before, whether they come from Dr. Bain or from another community organization, we want to have this all up in one place that's easy to access and easy to use. Okay. So that's it for me. And so thank you all. And now we're going to shift towards the first guest speaker, who's Roxane Bayancourt. She's the supervisor for Statistics Canada's data center, and she's been an analyst for StatsCan for the past 15 years, with occupying various functions within the agency. She began her career preparing and publishing analytical justice-related reports at the Canadian Centre for Justice and Community Safety Statistics based in Ottawa. She managed the data collection operational activities in Indigenous communities in Quebec for the 2016 census, and she developed and strengthened partnerships with data users from community organizations, academics, including Quebec's English language groups, in order to build awareness of StatsCan data and data services, to provide expert advice, as well as to offer some free learning and training services across a wide range of socioeconomic topics. Personally, she's helped us so much, as I said before, on our journey in terms of accessing information and the research we're conducting. So thank you so much, Roxane, for being here today, and I'll pass it on to you.
Thank you so much, John, for the very warm welcome. I'm incredibly honored to be here today. Today, I'll be discussing the experiences that I've had with the BCRC, as well as with the Balkan Quebec research team, Cheyenne and John. And I'll be providing an overview of Statistics Canada's data, the available data that we have. I'll be going over the roles and responsibilities of the Data Service Center, a center that helps users access data that's available to them. I'll also be providing a brief overview of what's to come for Statistics Canada, and provide as well as some information, as William Flood has mentioned, for the 2021 census, so the dissemination process that will be happening in 22. So I'll begin the presentation by discussing where does data come from. So Statistics Canada collects data directly from individuals and businesses. When possible, we use existing data from government and private sector organizations. Data can also be combined from different sources to provide additional insight into specific subject. Data collection is done in the most timely and cost-efficient manner, ensuring that data quality and accuracy is high, and that the response burden is lessened where possible. We collect data directly, so directly from respondents through various methods, which include paper, telephone, in person, as well as online crowdsourcing. And we also use existing data sources. So these are administrative data sources that we've been doing for the past 100 years or so. So government agencies and private sector organizations collect data as part of their ongoing operations. Once received, we turn them into official statistics. Now, statistics, our data is available on the Statistics Canada website. I'd also like to highlight in particular the Gender Diversity and Inclusion Statistics Hub. This hub is an excellent space where users from various community groups, provincial, municipal, academic settings can access information pertaining to visible minority groups, pertaining to gender, pertaining to all sorts of various themes. It's a hub where we can find analysis, where we can find resources, where we can find as well publication and data tables. On the Statistics Canada website, we also have a chat feature where quick responses can be provided to data users. We also have a info stats, or contact us. It's a email address as well as a phone number where we have agents standing by that are able to directly answer inquiries that data users may have. And this is live from 7 a.m. to 7 p.m. Eastern Standard Time for the phone lines. Now, if you're a researcher, we do have data available, microdata in particular, so non-aggregated data through our public use microdata files. We have the Data Liberation Initiative, which is a partnership between post-secondary institutions and Statistics Canada to improve access to Canadian data resources, as well as the RTRA, which is a real-time remote access. It's an online tabulation, allowing subscribers to run SAS programs in real time while connecting to a master file. And we also have more restricted access to our microdata. So this would be access for academic researchers, as well as for government researchers, where a proposal must be submitted and the data can be analyzed in a secure environment. These research data centers are located across Canada. Now, specifically the Data Service Center, we have various data service centers across Canada. I am the supervisor for the Montreal Data Service Center. We provide many services, including outreach, workshops, webinars, information sessions, customized products and services, educational support, as well as data advisory services. I was contacted through by the BCRC and John's team in particular to provide them with a custom tabulation, as they weren't able to find the data that they were looking for on our website, as we have certain cross tabulations available on the website, but specific tabulations are available through our consultative advisory services, where here, for example, we can we can create tabulations based on specific universes. In this case, it would be those who indicated Black as a visible minority, specific geographies, so smaller levels of geographies, economic regions, census divisions, census subdivisions, for example, as well as a wide range of demographic and cultural educational characteristics, and language, of course. So this leads me to the next section of my presentation, where I'm able to discuss what's available on our website. So we've touched a little bit about how the census has important visible minority ethnocultural data, the labor force survey as well, since July 2020 has included visible minority indicators in their analysis so that we can have important portraits of unemployment rate participation rate. What's to come for Statistics Canada? I'd like to talk today about our Desegregated Data Action Plan. Now, what is desegregated data? Essentially, it's data that can be broken down to have quality information. Here, the federal government has recognized the importance of these types of data in the most recent budget by specifically allocating funds to StatCan for this action plan. The funding aims to support more representative data collection, enhance statistics on diverse populations, and support government and society's efforts to address systemic racism, gender gaps, and bring fairness and inclusion considerations into decision-making. So, the guiding principles of this Desegregated Data Action Plan here is that data and analysis should be desegregated at the lowest level of population detail possible, while respecting, of course, equality and confidentiality standards. Analysis should focus on intersectionality, young, Black, women, as opposed to binary interactions. Statistics Canada's approved standards should be used for desegregation across all programs. Data should be available at the lowest level of geography possible. Now, essential desegregation, here including subcategories, Indigenous persons, racialized groups, gender, disability status, as well as additional desegregation priorities, sexual orientation, official language, children, youth, seniors, immigrants, low income, and veterans, for example. Next slide, if you may. More information in regards to the Desegregated Data Action Plan. Here, we're in a process of meeting various groups, community organizations to discuss, to engage. We're currently connecting. We're collecting and acquiring new desegregated data. We're trying to improve access to desegregated data. So we're in a process of promotion, of increasing sample size, of key surveys, for example, modernizing data collection strategies, improving collection of data desegregation, broadening indicators on statistics on vulnerable diverse populations, as well as to enhance capacity for longitudinal and intersectional analysis, as I had mentioned previously. Now, in the next slide, I'd like to just provide just a brief example of the powers, essentially, of desegregated data. Here in particular with the question of COVID-19 and how it has impacted.
Roxanne, just
Yes.
let you know that you're at the 2-minute mark.
Fantastic. I have 1 or 2 minutes. That's fantastic. Thank you so much, Ayana. So here, just a brief example of the desegregation of data where we can see in particular that subpopulation groups have been more impacted by COVID-19. This example is from Montreal. So this was a study done by my colleagues where neighborhoods with the highest proportion of visible minorities, the death rate was 3.5 times higher than the rest of the population. This was data that was derived from provisional Canadian vital mortality database, the 2020, as well as the census of population. So here we were able to use census data for that neighboring, that neighborhood aspect. Last slide. I just wanted to finally provide just a glimpse again of what's to come, in particular with the release schedule for the dissemination of the data of the 2021 census population. I know that a lot of researchers, academics, and are currently using 2016 data, and we're all eager for new data. This will be disseminated as early as February 9th, 2022, beginning with population and dwelling counts, working our way through the rest of the year, 2022, to language in August, as well as labor education, and other language characteristics throughout the rest of the year. Thank you very much.
Perfect. Thank you, Roxanne. That was very informative. We're now going to be starting our first question and answer session with Shania.
Hi, so if anyone has questions, feel free to type it in the chat, or most importantly, refer to the Q&A section, the Q&A button.
I'd like to also add that my contact information should be available for those who'd like to consult with me further, either at the end of this presentation or in the next days to come. I'm more than happy to answer questions. And we also have members of the team of the Diversity and Inclusion Statistics standing by to answer questions in the near future as well. We'd be more than happy to assist you with finding your data needs and exploring the various databases that we have.
Thank you, Roxanne.
So there are no questions then? If the audience is a little bit shy, please don't hesitate.
This is completely fine. I understand. We, like I said, I'm available afterwards. Anytime, my contact information will be available. So please, if you do have any questions, I'd be more than happy to examine them and be available for you. Thank you so very much, everyone.
Roxanne, can you repeat when you said when will be available to get COVID-related data?
So as it currently stands on the website, there is some COVID-related data. So it's just a matter of navigating the website. If it's particular to visible minority groups with the LFS, as I've mentioned, this is already released. So there is unemployment rates that are and participation rates that are released with the analysis, the monthly analysis.
Thank
Great.
you.
Roxanne,
thank you so very much. Yes.
Roxanne, I just had a pretty simple question. If it's just it's a point of detail, whether you happen to know or not, but and I understand I could probably look at this as well on the StatsCan website, but when it comes to the plan for making disaggregated data more accessible, and you mentioned, talking to community groups as well, and a number of other actions and funding towards that. Did you have has it been stated whether what the time frame is, or is there an ultimate kind of year or date when they want to have this plan fully enacted, so to speak?
It's an excellent question, John. And unfortunately, I personally don't have the answer to that question for you. I will certainly refer you to the team that have been working more closely with the Desegregated Data Action Plan.
I think there's a message for you in the chat, Roxanne.
Okay. I can also answer questions in French.
Yeah, it's.
I'm not sure that I can see it, Shania.
Yeah. Oh, you can. It says it's to panelists. You should be able. Graziella says, "Thank you, Roxanne. De quoi nous réconcilier avec les chiffres?"
There are two questions in the question and answer box. Ayana,
Yep.
if you could just open it up.
Okay. Oh, and there's also, I don't know if you got that first one. Okay. There's two questions from Kennedy. John, may I ask you to speak more about the eligibility criteria for the interviews that you conducted? You mentioned academic background, but what else do you consider?
Yeah, thank you. So in terms of the the interviews, and I think Candida, I'm not, if maybe you're referring to the focus group interviews. So initially the eligibility for that, for people we spoke to were people specifically in the English speaking Black community itself. So people who are part of the community, but also people who work with the community in some capacity. And there's different capacities that people did so. I mentioned there was some people from religious organizations, some from community centers, some academics, some students, some in the health field, some in the arts. So ultimately, the only criteria for people who did the focus groups was that they're a member of the English-speaking Black community, or at least they self-identify as one as well, and that they're doing something, even if it's volunteering or in their full professional capacity, that actually relates to the community itself.
Perfect. And there's another anonymous question. Says, how do we feel about the data collection and the potential privacy concerns?
I believe that may be a question for me. I think I can elaborate. That's all personal information collected and used by Statistics Canada are protected by the Privacy Act and the Statistics Act, and remains highly confidential.
And there's another question for you, Roxanne, from Candida as well. She says, Roxanne, I will likely email you later, but are you aware whether there is any data available on an individual level?
In regards to?
As opposed to the neighborhoods or population level. And
the
then,
study in particular,
I
think the study in particular was done, I'll send a direct link afterwards for this particular study, but it was done on a neighborhood level. We cannot disclose information necessarily on an individual level.
Perfect. And she also said,
if I can jump in, because I noticed Candida's question and answer. She said that later she's actually talking about specific health outcomes and healthcare use. So I'm just gonna say, Candida, hopefully this is helpful, but I would refer you to the Canadian Community Health Survey. It's also conducted by Statistics Canada. They do it every year. I believe the sample size is in the hundreds of thousands, maybe at 1 or 2, maybe 300,000 people or so. And it's very it's a lot of questions they ask. It's like 200 questions, so it's quite detailed. And so it's something that we've tried to consult with, but we also have issues in terms of the level of detail or the specific groups we can look at and analyze and separate from the rest. But at least it's a place, I would say it's a good place to start if you weren't aware of the Canadian Community Health Survey.
Excellent, John. I agree.
Okay, seeing that we're kind of pretty much on perfect timing for the break, I think it would be best to start our break right now. Just a quick 10 minutes break to let the presenters just have a sip of water. And when it comes to Bridget, I see that you have your question here. Maybe if you're okay with that, maybe actually I'll ask you if you could answer the question, because you mentioned you'd like to have you have the answer about the deadline in terms of the plan for disseminated data. So I was actually a bit wrong. We might have 1 or 2 minutes left. And Bridget, if possible, I'd like you to unmute yourself if you're comfortable with it, if you wanted to speak about that as well. And Bridget Chavez is also from Statistics Canada as well.
Fantastic. Thank you, Bridget.
Hello, John. This is Bridget. Can everyone hear me?
We can,
yes.
yeah.
Okay, good. So I work at the Center for Gender Diversity and Inclusion, and I just wanted to tell you that we don't have a deadline as of now. We are really interested in, we are presently making plans to meet with various groups. We would really like to reconnect with your group and to begin discussions. But we would also be happy for you to reach out and connect with us to let us know how you would like to be engaged. And I can certainly pass on your question to my team, and we will get back to you with a proper answer.
Thank you so much for that response, Bridget, and for informing us of that. As Roxanne knows, the dialogue has already commenced since a while, and so we're happy to build on that and continue speaking, meeting more people who are part of your organization and vice versa. So thank you for letting me know about that.
I'm
Also,
extremely happy.
Also, one last thing, if I may, we are really eager to find out more about the data gaps that you found. And you did mention a report. If I heard correctly, that report is already available and we would just have to ask for it. Is that right?
Yes, so we have our initial analysis of outcomes and information gaps. So it's ready for order. So if you go on our website with our on our data guide, you can ask to order that specific report, and it's called an analysis of the outcomes and information gaps pertaining to the English-speaking Black community. Some other reports, such as the focus group, the survey findings, and the ultimate report of our project, are still to be published, but when they will be published, they'll be put on our website, and I'm happy to even put anyone on a waiting list for that so that they're informed as soon as it's available.
Great. I already sent a message, so I will be waiting for that, and we will consult it to see what we can do as Statistic Canada to address those gaps.
Great. Thank you, Bridget.
Thank you.
Thank you. Thank you, everyone, for your participation. So this ends the first question and answer session. We now invite you to take a 10-minute break, and we'll pick back up afterwards.